Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with prevention of spina bifida clubfoot. Clubfoot is commonly seen with people that their legs, the foot is facing each other and is inward. So that kind of experience is not something that one ordinarily would want to any of his known person to experience it. But the funniest things, or what I would call the problem, is that some of them are preventable. So those that are preventable, do you know how to prevent it? Or can you help people who will be pregnant in future, ladies, young girls, pregnant in future, to tell them this is one of the ways to prevent something like this happening? Truth is that it's not all clubfoot that are preventable, but the idea that spina bifida could lead on to clubfoot is, and spina bifida is preventable, then there is a need for us to create more awareness of these preventive ways that will make more families or future parents happy and not experiencing what they probably would have prevented. So if to know more about this, I shall go into the slide section where I will be able to explain further the prevention that you can do to make these things possible. As usual, click on the like button, subscribe, and more knowledge will be passed on. The outline: objective, introduction, prevention, laboratory diagnosis, and conclusions are all that I shall be taking care of here. To create the necessary awareness of the preventable measures of spina bifida and clubfoot, expose the role of the medical laboratory scientists in early detection and prevention of these conditions. The introduction: spina bifida is a birth defect where the spinal cord doesn't close completely, leaving the spinal cord and nerves exposed or protruding through a gap in the vertebrate, as shown here in the picture. It is caused by the failure of the neural tube to close properly during the fetal development. This happens between the first trimester, very early, leading to a gap in the vertebrae and potential exposure of the spinal cord, usually located in the back, affecting the spine and spinal cord. The mild one is called spina occulta, and the strong one. According to many literatures, the condition occurs about once in every 1,000 births. The content of the sac at the back of the baby may be of three varieties: meningomylosis, the meningocyte, and the sphingomyelitis. The chief symptoms are paralysis of the bladder and rectum, weakness in the muscles of the leg leading to clubfoot, trophic ulcer, and other conditions. These are caused by pressure on the nerve centers. So at times the clubfoot itself, when the baby's foot is not well placed, especially in obese women, the clubfoot is formed. Clubfoot etiology is of two types: idiopathic and non-idiopathic clubfoot, medically called Thales equinovarus. 80% of unknown causes, while 20% is known. The 20% known is the one called non-idiopathic clubfoot. It affects more male than female, of ratio 2:1. It is both genetic and environmental, and that's where the prevention lies. So we can easily understand how to prevent it from that genetic and environmental. The prevention. Let's start by preventing the genetic factors. We can start with the family. If the thing is familiar, that is, it has been experienced in the family before, individuals with a family history of the conditions are more likely to be affected. So prevention lies more in taking caution early by laboratory measurement of known parameters in the amniotic fluid of the person, and apart from the fact that if the two families have a familiar history of this clubfoot in their family, it is better they do not get married. Environmental factors could include the surrounding fluid, the amniotic fluid level. Inadequate amniotic fluid level during pregnancy have been implicated as a potential environmental factor that may elevate the risk of clubfoot. Maternal smoking during pregnancy has been identified as a potential environmental risk factor. So we must look at other factors that could cause it and advise people against that. Others are medication. Certain medications, particularly seizure medication, have been linked to an increased risk of clubfoot when taken during pregnancy. Pregnant individuals should abstain from smoking and alcohol to safeguard fetal development. All women of childbearing age should take a daily folic acid supplement of 400 micrograms to support a healthy pregnancy, because the neural tube formation starts very early, and that is when this deformity usually happens, when the neural tube is not well formed. Avoid excess weight gain during pregnancy and pesticide. The excess weight gain will always create the problem for the foot, the stretching of the baby foot, and that's part of what has been found, and could also affect it. Individuals with pre-existing health conditions like diabetes should work closely with healthcare provider. Consistent prenatal checkups enables early diagnosis and interventions. Yeah, the laboratory, as I earlier indicated, is a safe place to detect all this problem early enough, not when it has happened. So the mother needs to probably have a folic acid check before even contemplating having these babies, because at times folic acid in itself, the supplement could be more than necessary and cause other problems. But when it is not adequate, the mother wouldn't be advised as usual to take more folic acid necessary for this safe delivery. Folic acid is very responsible for so many genetic corrections that if not taken, there are certain things that happens that may not be palatable. So folic acid test could be done. There is also the need to collect the the baby in the womb amniotic fluid, which should show these values. The one that concerns us mainly is the AFP. If it is low, it's not enough, then it's suspicious. It's not that the baby should be aborted, but the necessary things that has to be done by the clinician will be done. And when the baby is born, early corrections will now be done to the baby. Finally, in conclusion, spina bifida and clubfoot are preventable if we take extra care before conception of the baby or during the gestation period, as highlighted before. We must also know that the X-ray and ultrasound scan are also useful when the deformation has happened. But what do? It's just to use it to help in the early treatment, because there is a way the deformity is corrected, so that very early baby bones are adjustable. It could easily be corrected. The medical laboratory investigations help to detect and also prevent any of the two from happening, except the idiopathic one. Nevertheless, there are people who have lived to over 90 years with this condition. So if you like what you have seen and the presentations, just click the like button, subscribe. This is the 177th video on my YouTube channel.